Hi, dear audience. My name is Armen Sargsyan. I am a student of Healthcare Administration faculty. Today, I want to talk about coronavirus pandemic, the most actual problem that seriously changed our lives. It brought so many restrictions that we feel like we are in prison. According to the World Health Organization, the total number of COVID cases is more than 65 million, and the number of deaths is about 1.5 million people. These numbers are still growing rapidly. The first time that we heard about the new dangerous virus is December of 2019. The outbreak of the disease started in Wuhan, China. It was reported to the World Health Organization on December 31st of 2019. After a month, World Health Organization declared the COVID-19 outbreak as a global health emergency. After it spread across several countries and affected a large number of people, in March 11, 2020, it was classified as a pandemic. The first months were the golden period that public health specialists and governments missed to act in order to stop the spread of the virus. Coronavirus pandemic caused by a virus called severe acute respiratory syndrome coronavirus 2. It's a Baltimore class 4 positive sense single-stranded RNA virus. The genome surrounded by N protein or nucleocapsid, which is playing an important role in implementation of the virus genome into an infected human cell and turning it into a factory of self-reproduction. Virus genome is protected by lipid envelope, which has on it a membrane or M protein, spike or S protein, and the envelope or E protein. Each of those have their specific functions, but we don't know finally understood. Found out that the coronavirus spike or S protein help the virus to attach to the host cell angiotensin converting enzyme 2 receptors that found on the surface of many human cells, including lungs. The E protein plays a role of assembling in the virus and controlling the membrane permeability of the host cell. According to the CDC, coronavirus spread through respiratory droplets or aerosol that produced when infected person coughs, sneezes, talks, or breathes, and the healthy person can be infected if he inhales the droplets and aerosol. Besides this way, it might be transferred from the infected surfaces through mouth, nose, or eyes. The population at risk are older adults and people with certain medical conditions like cancer, COPD, hypertension, and other heart conditions, kidney diseases, diabetes, obesity, smokers. The mortality rate between those contingents is also much higher. The incubation period is from 2 to 14 days. The most common symptoms are fever or chill, cough, shortness or breath, fatigue, muscle or body aches, headache, loss of taste or smell, sore throat, runny nose, nausea, vomiting, and diarrhea. In case of emergency warning signs, CDC advised to get immediate medical attention. Those signs are trouble breathing, persistent pain and pressure in chest, new confusion or inability to rouse, or bluish lips and face. Lucky for us, the preventive measures are pretty simple, and those are to keep social distance for 6 feet. If you will ask why 6 feet, it is because the droplet and aerosol usually travel less than 6 feet. Wear a mask when you are in a public place. Frequently wash your hands for 20 seconds with soap and water. Use hand sanitizer, the level of alcohol which is more than 60%. Disinfection of surfaces. Important step is also to educate all people about COVID-19 disease, about its signs and symptoms, self-quarantine and preventive measures. We do not have ideal cure for COVID disease, but the treatment plan used antiviral medication like remdesivir, dexamethasone to suppress overactive immune system, pain and temperature relief medication, and medication to support immune system or convalescent plasma monoclonal antibodies. Antibiotics used to fight co-infection, but not effective against the virus. We do not have yet a vaccine. The scientists are working to develop an effective vaccine. Here are some examples of vaccines that now in a stage of clinical trial, but we don't know yet sure about their effectiveness and safety. People sometimes complaining about quarantine measures. I know that everyone would get the virus sooner or later. People would develop herd immunity. Quarantine is the step to slow down the spread. In order to avoid from having many sick people in emergency condition that needed treatment in hospital at once. So also to prevent exhaustion of the capability of medical facilities. And here is the rhetorical question. So what to do? For now, it is only to keep the preventive measures to stop the spread and seek medical help in case of emergency signs. Thank you for watching. There are the references. Thank you.